Healthcare in Alaska is challenging, especially rural healthcare. I have a lot of patients from the Kenai Peninsula, and it's difficult for them to drive the 150 to 200 miles to Anchorage to see me for a consultation. That's why on Mondays I fly to Soldotna and see about 40 patients in the clinic that we built there. I feel like I'm almost late every time I come to the airport, rushing to catch this plane. The government spends hundreds of millions of dollars every year to supplement rural healthcare, and the Kenai Peninsula is considered rural healthcare, but I do this without any government support. The government also gives subsidies many times to people to build rural healthcare facilities, but we build our facility without any government subsidies. Nice cold day, right? What's up? Love Grand Aviation.
Lift levers up and back to open each one. Fire extinguishers to my left.
If a patient from the Kenai Peninsula needs surgery, the typical perioperative workup routine is that the patient comes and sees us for initial consultation. Then if they need surgery, they need to come back for a preoperative history physical exam, and then they need to come back again for the surgery. And then after surgery, there's typically 3 postoperative visits. That's a total of about 6 visits for a surgical consultation. If you live in a rural community and have to fly to Anchorage or drive a significant ways, that can quickly become difficult to impossible. We built our clinic in Soldotna so that patients could see orthopedic subspecialist care without traveling very far from their communities. I'd be more profitable if I stayed in Anchorage. My clinic in Anchorage is booked out for months, but there's one more big reason in addition to my orthopedic clinic that I fly down to the Kenai Peninsula on Mondays. Hey Mom, how you Dad? How's it going? My parents pick me up from the airport every Monday and bring me into work.
Gotta keep him working.
All right.
How do you like my coat?
I love your coats.
Yeah.
All right, my parents typically drop me off and give me their car so I can go into work. All right, give me a hug. Love you, bye-bye. See you later. All right, see you, Dad.
Okay.
Are you get the key in there?
He's hanging on the dashboard.
Okay, see you guys. My parents and my grandparents are pretty amazing. Homesteading in Alaska is definitely not easy. Farming in general in Alaska is not easy, and they made a go out of it, and we're really successful. This is our orthopedic clinic that we built out, but I got to get going. I already got patients in there, so I better get to work. All right, last thing I need to do is get my work clothes on. Let's do this. You know, this old surgeon I knew back in residency, back when I was working in the VA hospital. The VA hospital can be a total drag. I was beat down, worked to death, and I'd be walking around the halls with him, and he'd look at me, and this old surgeon looked like Tom Selleck from Magnum PI. He's super cool. He had one of those mustaches. He always had a smile on his face, and he'd stop me and go, "Hey, Owen, can you believe they pay us to do this?" And he has his infectious, good attitude about himself. Then he'd walk off, and I'd think, you know what, he's right. What we do is pretty cool. I better get started. Got a big day ahead of me.